In today's episode, I'm excited. I'll be talking with Dr. Cliff Dow. Dr. Cliff has owned and operated a nationwide private chiropractic radiology practice since 2004, and he's an internationally sought after speaker and has published both in chiropractic and medical literature on the topic of chiropractic, spine, and musculoskeletal imaging. Welcome, Cliff.
Thank you, Sebastian. Thanks for having me.
Absolutely. Hey, let's get started with you just sharing a little bit of your story and why you do what you do.
Oh, sure. So I guess it depends how far you want to go. So my dad, he's retired now, but he was a medical radiologist. And so he went to medical school and radiology residency, and he practiced as a radiologist in our local hospital. This was in Ottawa, Canada, for, I don't know, 40 years or something. He retired in his mid 70s. And so I think him and I kind of have the same analytical brain. I don't know if you've heard of this before, Sebastian, but a lot of radiologists aren't social or extroverts. And I think I'm the same way. I'm not totally extrovert. I like some alone time. I like to get work done quickly without any distractions. And I applied to chiropractic school. I mean, I knew I wasn't, honestly, get into medical school. And I wasn't actually sure if I wanted to go into medical school because I didn't like all how corporate it was and how it was me mostly about making profit, and they weren't really looking at the real reasons why people were hurting or had different diseases or whatever. So even before I went to chiropractic school, I knew I was interested in radiology, but not really sure how I could kind of, you know, weave that into my practice. I was actually more interested in treating athletes. I played varsity sports in high school and college. And so I was very interested in that. I just thought it was cool. I still think it's cool, actually. And I think most people think it's cooler than radiology, unfortunately. But throughout school, I kind of hung out with the chiropractic radiologist, and I would kind of shadow them once a week in the mornings. And I got to know them really well. It turns out that they're not bad people. They have their own little quirks just like I do, but I really identified with them. I think I like looking at x-rays. I like being able to kind of help people that way, help patients that way, and kind of also help my fellow chiropractors, and hopefully by doing all that, kind of elevating and supporting my profession that way as well. But I didn't think I would get in. I thought you had to be really smart to be a chiropractic radiologist. Well, I think you have to meet certain grades and stuff, but I think what they were really looking for, at least in my case, was someone that really wanted it, like showed the motivation and wasn't just doing it. It would be wrong for money because we don't make that much more or any more than the regular chiropractor. And in fact, I think it's probably less. But anyway, I got into radiology and I went to chiropractic school in Chicago at National. And then radiology, I got into LECC, which is where I'm at. Not where I'm at, but I'm in Southern California. And, that was a brutal process. I don't know if I mentioned this to you before, but the application wasn't so bad, but just getting through the residency was hard. But, like a lot of hard things, you learn a lot during those hard periods of life. I learned a ton in radiology. And actually, that was 3 years. Then after those 3 years, I really wanted to learn more about other kinds of imaging and kind of more broad scope. So I did a 6-month fellowship at our local teaching hospital, UC Irvine. That was completely unpaid, so I made not much money during those 6 months. It was a little bit hard, but I learned a ton more in those 6 months. I made some good connections, and then I started practicing after that. Practicing meaning radiology practice. I did a little bit of chiropractic stuff just to keep things afloat. I would just kind of sub in for my friends of mine when they couldn't make it in their practice. And I taught part-time at LACC, the chiropractic school that's nearby. Then eventually my practice grew where I could do it full time. And so that started 2004. And so it's been, what is that, 21 years now or so. And that's all I do now is our practice is like 99% reading x-rays and other imaging for other chiropractors throughout the US, a little bit beyond that, but mostly in the US.
So tell me a little bit about like what your practice exactly is or how you work with chiropractors for imaging?
Oh, that's a good question because radiology is so technologically dependent. And so we have I call it our radiology systems management or radiology management system. And it's basically a software program that's pretty robust. And so doctors who sign up with us that want us to read, say, an x ray, they submit the x ray on the imaging platform. It takes a couple minutes to get here. Actually, before the submission, they decide which X-ray to send, and they can type in a little background about the X-ray, like this patient has pain here, and they had a car accident on this date, and I'm looking for this, or what is this white blob here, or something like that. Or they don't have to put anything. But anyway, we get it within a few minutes, and I'll say our pride and joy is getting things done kind of quickly. So, quickly is to us is next business day. Sometimes it could be one extra day, but so if we get something today, Sebastian, you'll have results tomorrow typically. And we have this radiology system has the ability to request a stat or rush request. And so our on-call radiologist, usually it's me, but it could be anyone. We'll get on it. Usually we have it done within a few hours, but it could be within an hour. But latest, it would be the first thing tomorrow morning. So I think that really helps the chiropractor convey that information back to the patients and really helps the patient kind of understand their health a little bit better, even if it's ruling out some tumor or some bad disease. I think just gets the patient a little bit better understanding of their health and maybe helps that relationship between the doctor and the patient a little bit better too.
Makes sense. And help me and maybe even some of our listeners understand a little bit better. Is this the sort of situation where maybe some docs, maybe they don't even do imaging? And so, on either standardly or on occasion, they might refer someone out? Or do you work with docs where like they typically review their own results, but maybe they come across something like unusual or confusing? Or why might a doc work with you?
That's a good question. Well, we have I think, a good mix of different chiropractors and different practice scenarios. Probably our most common are chiropractors with their own X-ray system in-house, and they're taking X-rays. And then out of those chiropractors, some of them just send us everything routinely. They just want that added level of certainty or confidence when they're conveying the results to their patients. And then, out of the chiropractors with their own X-ray, some of them just send us ones that they're not sure of. They see something on the X-ray and they don't know what it is, and they just want us to tell them if it's good or bad or what they need to do with the patient. So we get those. And then I guess there's a third set of chiropractors, and they send us all their personal injury cases. And if you're familiar with it, it tends to take a little more attention, and a lot of these med legal or personal injury cases, they require you to have a formal written report on the x-rays. And so we get some chiropractors that only send us personal injury cases as well. And then a minority of our clients are chiropractors without x-ray in their office. So they would send their patient to an imaging center or to a hospital for imaging. And if they don't like the report or they don't trust the radiologist, or it's taking a long time to get the report, and then we get those studies and we provide our detailed second opinion on those as well.
I bet that could be coming, it could be really helpful since you have kind of a chiropractic background or angle, which probably, gives a little bit of a different result or reports, maybe compared to like a standard imaging center, if you will.
Yeah, that's a good point because, and I've say my opinions changed since in the past 20 years or so.
Hmm.
I thought our job as, just generally as radiologists was all the same. Like there's no difference between me as a DAC or chiropractor radiologist and say medical radiologist. I thought our reports should look the same, but I quickly realized that it's not. And I think that the meat of our reports are the same. Like, okay, there's arthritis and there's no fracture. But then everything else on top of that, our reports tend to be a little bit longer and more detail oriented. And actually, it's funny. I thought in the beginning that it's because the medical radiologists were just either they didn't care or they were blind, or they weren't looking at the x-rays. But now I think it's because they're too busy. They have, not all of them, but most medical radiologists work in a group and they have too many x-rays to read for the number of hours they're working. And so they're reading too many and they can't spend a lot of time per x-ray. So that means when they're dictating the report, they can't take more than 10 seconds to spit out a report. And it sounds crazy, but for them, every second counts because they're reading. I have a friend that works at Kaiser. I don't know if you've heard of
Oh yeah.
Kaiser
Eh,
Permanente.
yes.
And it sounds like you have some stories about them, and I do too. That
Right.
could take another hour. But so my friend, he's brilliant. He's super smart. He's a radiologist. And he went to one of the best MRI fellowships in the world. It's in Ohio, and the guy's like world renowned. But anyway, he works at Kaiser, and I was asking him like, "Hey, how many X-rays do you have to read in a day on your days where you're reading only X-ray like me?" He's like, "Oh, on a regular 8-hour day, it's 200." I'm like, "200?" And then, okay, so keep that in mind, 200. And then, well, how many do I read in a day? Well, I remember I've never repeated this because I hated it. My top day, Sebastian, in terms of how many I've read in a day is 70. And I did not like it because I felt rushed. I felt like I probably missed things. I think I must have skipped lunch that day because I just didn't have time to eat. And I vowed never to do it again because I didn't feel like I was providing, good quality care for those patients and for the chiropractors. So 200 versus 70, so that's almost 3 times the amount. And then not only that, Sebastian, the X-rays they're reading, I'm pretty sure they are a lot more complicated than the chiropractic ones that I'm reading. These are patients out of a hospital. Some of them can't even walk. Most chiropractic patients can walk. And so they're dealing with more complex things where there's a lot of things going on the imaging study. And then additionally, so on top of that, they have to, so in their system, when they're reading x-rays, it automatically shows up if there's a prior study. It'll show up right on the screen. Say I'm reading the study from today and it'll say, oh, a couple weeks ago, they had another x-ray. A few months ago, they had another x-ray or a CT scan or an MRI. And as the medical radiologists, they have to look at the prior one and compare it with the current one. And I didn't know this until later, but they don't get paid any extra for doing that. So it does take extra time and they have to do it, but they don't get paid any extra. And I think it's terrible. It's a terrible, whatever insurance reimbursement system. We're a direct point of service sale. So we bill the doctors directly and we bill more. If they want us to do a comparison, we'll do it, but we only do them at their specific request and then we charge extra. So these poor medical radiologists, they get paid, pretty well right off the top, but they got a lot of work to do. It's difficult work and it's a lot of work within a short time frame. So that's why the reports kind of go back into what we are talking about a few minutes ago. Is that's why the reports are a little bit shorter than ours, not as detail oriented.
That makes sense. And, I guess when you think about the corporate workspace, right, it's all about efficiency. And like you're saying, shave off those 2 seconds or what have you, just to hit your numbers. And I can't imagine that really helps, say, a PI case, right? To have just like a little blurb.
Yeah, yeah, yeah. They don't like that. But that's why they like AI so much. We like AI too. I mean, we have to use it. At one point, it's getting better and better. And eventually, it's going to interpret our x rays for us. But the medical radiologists, they've been on it, but their thinking is that it's going to help them with their volume, right? So they can throw in 1,000 x rays. It's going to spit out a report within minutes. And all they have to do is sign off on it and take liability case someone wants to sue somebody, the radiologist will still get sued. But I think that's how they're gonna. I mean, that's maybe a year or longer down the road. I don't know how long, but as you know, and our listeners here know, AI is accelerating like crazy. So it'll come, just not ready right now. As a matter of fact, I had a meeting earlier this morning with a company that looks at x-rays and it'll you just kind of throw the images in there. So cervical flexion extension views, and it'll automatically calculate how the vertebra is moving, anterior, posterior, angular. changes and automatically spit out a report within 60 seconds. And yeah, even if I don't do them that often, but man, it would take me at least 5 to 10 minutes maybe to do that to that extent, that this specific company is doing it. And so I think something like that can eventually do that and I'll catch everything on there, then that's really going to help the medical guys with their workflow.
Yeah. Man, AI is coming for everyone. That's all
Yes. Whether you like it or not, it's on its way.
for sure. I've seen some of your posts on Facebook with some mysterious or curious imaging. What do you find most interesting about, imaging and working with chiropractors in this regard?
You know, radiology is so interesting to me, Sebastian. I feel like it's so cool to be able to see inside a body without having to cut it open. And that kind of goes along with I think most people, but especially chiropractors. We don't like sending people to surgery. We don't like telling people they have to take a pill or something like that. And so I'm like, wow, this is kind of cool. A little X-ray takes like not even 1 second of exposure. You can see the bones inside their body. And not only that, the bones can tell a lot about our health. Not always, but it's kind of a 1 second picture, but it can kind of tell what we've been doing for the past 10, 20, 30 years or so. So I think that's just fascinating. And then with different types of imaging, we have X-ray, but we also have CT scans and MRI, and you can tell a little bit more with those things. They cost a little bit more, and MRI is nice because there's no known harmful effects. Not as harmful as ionizing radiation.
Yeah,
There are some effects, but they're not that harmful. But you see a whole lot more on MRI that you would never see on an X-ray. So I think it's just fascinating to be able to see that stuff and then use that to help educate the patient and get them better depending on whatever they have. I think it's pretty cool, and no needles, no pills, no cutting the skin open.
exactly.
I like that.
Yeah, exactly. So, what are some common challenges that some of your chiropractor clients face when it comes to x-rays and imaging?
Oh, yeah. So one of the things, and I did this presentation once for, I don't remember who it was, and they wanted to know what I thought about chiropractic radiology versus medical radiology. And, you know, kind of like how I mentioned near the beginning of this, I thought we should all be the same. Like if you're a radiologist, a chiropractic or radiology or medical, if you're reading spines, musculoskeletal stuff, it should almost be the same. But no, again, it's not. So one of the challenges I think for chiropractors who have x-ray in their office is that first of all, the x-ray machines that are available to us, meaning affordable to us, so these are all in the sub 100,000 range. $100,000, a lot of money to pay, but those are all lower end x-ray machines. The ones that we see in hospitals or big imaging centers, those things are 300 grand, maybe 400 even.
Yeah.
And they do the exact same thing, Sebastian. The reimbursement is exactly the same. And yeah, so this is kind of, for me, it's kind of fascinating. 'Cause like, why would you pay an extra 200 grand for something that does the same thing? Well, because the quality is better. They can see the bones and joints much better, and it's a lot faster as well. So we don't need the speed in chiropractic. We're taking maybe a few patients' x-rays a day at most. But in the hospitals, when these vendors are selling to hospitals, they have to quote numbers that incorporate 100 patients a day. And so the faster they can do them, the better. And they have better quality too. So they have a much better, I don't know what you call it. I call it juice. Like it's they can harness more electricity or something power from the power box so they can zap people with kind of, I guess, more radiation but in a small amount of time so the actual exposure is less, and there's less chance for retakes actually in the medical world as well, because usually when they take the first one it's okay, and well, less reasons for retake, because we in chiropractic, if we take an x-ray and it's not great quality, chances are we're probably not going to take another one because it takes so much time to do it, and you may not be able to get a better image quality based on our X-ray machine quality level to begin with. But in medicine, if they take an X-ray and it's not like perfect, a lot of times they get chewed out. And so there's staffing changes, right? There's the radiology technologist that's taking the X-ray, and then their boss is a radiologist. So the boss will come back and say, "Hey, Sebastian, get that patient back in here and take that X-ray over and over again until you get it right." And then you're like, "Okay, okay." So it's a slightly different scenario. But that's one of the challenges I think with chiropractors with X-ray in their own offices is getting good quality imaging.
Mm, makes sense.
But a lot of it is because we're limited by our equipment.
Makes sense. Do you have any actionable, say, insights or tips maybe that you could share with the chiropractic community? For those docs who may not even know what they don't know about getting imaging?
Oh yeah, I have a few. I'd say, I mean, these are just off the top of my head, but I would say if you're looking to improve your image quality, I mean, I could just do a blanket statement, just, review all your notes or something like that. But I think one of the things that I see in our practice with the x-rays that come through is that there's not enough collimation. So there's these shutters on the x-ray tube, Sebastian. They shutter this way. You can close it all the way or you can open it all the way. And there's ones that go this way too. It doesn't focus the beam, it just narrows the beam. And doing that, if you collimate just to the area you want to see, that itself will improve the quality of the image that comes out. If you use the same, factors, there's a voltage and current or amperage factors. You keep all the same factors and you just narrow it in just a little bit, maybe a little bit this way. There's an immediate better image quality that way. So that's one thing it's super quick, it takes a second or two to do. Number 2, I would say, so most of the X-rays we get are spine, of course, but we get other stuff too, like extremities, like knees and shoulders. But we also get chest X-rays every once in a while. And a lot of the chest X-rays we get, I'd say even at least half of them, I think are not good enough quality. A lot of it is because of the X-ray machine limitations that we have. But number 2 is pretty good reason too is that we forget how to take the chest x-ray because we don't take them very often. The factors are different, the positioning of the patient is different. So normally we take our lumbar views this way. We say A to P from anterior to posterior. But for a chest x-ray, we turn them around and we take it from the back to the front. And that helps us see the lungs a little bit better. And then the voltage and the amperage are totally different as well because we want to see different things. We don't really want to see the bones. We want to see the lungs and the blood vessels and stuff like that. And so if we want to take better chest x-rays, hopefully you don't have to take one. And to be honest, Sebastian, I don't even like reading them because we don't see that many of them. And yeah, I'm really a spine and joint guy, but we'll read them, nonetheless. Yeah, so review your chest X-ray technical, parameters to see if you're getting it right. And sometimes they don't want to do it or they don't want to bother. It's much better to just send the patient somewhere where they do them all the time. So to a local imaging center, and they do chest X-rays all the time. Plus, their imaging equipment is probably better than the stuff we have.
That makes sense.
Oh, sorry, I have one more. Lately, I've been doing actually, I think I did it when I saw you at in Vegas, is my talk on radiology lately has been about how to reduce radiology errors, meaning when we're interpreting X-ray. And so one of the best things they say you can do, and it's especially easy now with digital X-ray, is you just send the picture to someone else. Send it to one of your colleagues. Doesn't have to be me, although I think I'm the best person to send it to. And there's other DAC bars if you're more comfortable with using another DAC bar. That's the best way to reduce radiology errors. It just takes a little bit of time, and if you send it to me, I'm gonna have to charge you, and so it costs a little bit of money. But really, if you send it to another chiropractor, that will help reduce the errors. But again, yeah, I'd have to say send it to me. I think best practices is to send it to a DAC bar. If you're a chiropractor, you should be sending your films to a DAC bar for an overread or a second opinion.
I think it makes sense because you have two types of errors, right? The false positives, but even the false negatives, which I guess either one.
Yes. Yeah, that's exactly right. So, overcalling or undercalling things is what I like to call it. But yeah, I mean, we make errors too. I don't want to make it look like I never make mistakes, but I'd like to say we never do. But no, we make mistakes too. And a lot of it has to do with, well, so I see it in myself and in my associates. It's just not having a focused time to read our x-rays, or we're rushed like the medical radiologists, we're tired. Like, a lot of my associates, they're teaching full time, at a chiropractic school or something, and so they're reading x-rays in off time, so either late at night or early in the morning. I think I would prefer early in the morning, but I think most of them read them after dinner or something. I'm like, that's not ideal. That's kind of wind down time, but that's the only time they can read them. Or sometimes they do read them during the day. So there's a lot of things you can do, I think, to minimize the mistakes that we make. So, but that's one of them. Send them to someone that you trust to take a look, or second look, or third look, and that'll help reduce your errors greatly.
Where you're reading them during your sharpest point of the day and not when you're, like, rubbing your eyes because 'cause you're ready to go to sleep.
Yeah, yeah. That is one of the benefits of radiology, is that you can kinda do it whenever you want, but ideally, you should be perky and alert and focused, attentive, all that stuff.
Right.
But, we're human too. We don't always have the ideal scenario.
Right. Now, some docs, especially those I think starting out, are often wondering, like, should I install X-rays in my office? Is there anything that you would want to share with docs that are maybe kind of curious or perhaps even reluctant to
Hmm.
use much imaging?
Oh, could be that, I mean, I think they would know better, to be honest. Sometimes it's technique based, Are they doing CBP, like I mentioned before, chiropractic biophysics, where they're heavily reliant on the x ray and having access to it and comparing to a prior study to see if there's any changes? Okay, that would be highly beneficial to have it in office. But if you're a chiropractor that does, say more soft tissue stuff, sports injuries, and you don't see a lot of fractures, then you probably don't really need an x-ray machine. You could save your 50, 60 grand for something else, I'm sure.
Right.
Yeah, so I wouldn't recommend it from a business standpoint unless you're going to do something else with the x-ray. It's got to be something that's sustainable, right? Some chiropractors that they have x-ray, but they may have some other imaging like a cone beam CT, like a little mini CT machine. Some have ultrasound, but they have a system where they can accept outside patients, and so that helps to kind of defray the costs a little bit. So they're kind of like functioning like an imaging center where they can accept outside patients, do the imaging for other chiropractors without that imaging modality in their office, and they can make a few bucks that way.
Interesting. Well, this has been enlightening for myself. But before we sign off, do you have any final advice that you'd like to share with the chiropractic community or anything we might have missed? And also, please tell everyone the best way to connect with you online.
Oh, sure. I would say for new docs, well, even the seasoned chiropractor, I feel like chiropractors, we're the only ones that really know how to take care of spine issues. We don't do all spine issues, but most. So just say low back pain for one. I'm saying this because I feel like a lot of chiropractors don't feel like they are, or because maybe another chiropractor talked down to them, or an orthopedic surgeon thinks we mean nothing. But no, I think they're wrong. I think chiropractors in general, as a profession, we are the best people to come to if you have some spine issue. It could be just posture, no pain, or it could be low back pain, could be headaches, neck pain. And I really believe that. And I think if we as a profession believed it more, it would give us a little more confidence. It would give us a little more certainty and help us kind of treat people a little bit better, and get more patients in our office and get overall the population a little bit better and out of pain. Contact information. There's not many Cliff Towers around. I think you can Google my name, Cliff Tow, and I'll show up somewhere. I'll respond to a message you send me on Facebook or LinkedIn. I have Instagram too. You could message me there or somehow contact me there. You can call me. My phone number is 714 876-1126. You can email me. You're gonna have my email printed out down there or something, or I can
Yeah,
say it.
we'll make
Okay.
sure to link to your website and all of your contact info and socials on the website.
Oh, yeah. My website has a way to contact me, but my official email is cliff@clifftowdcdacbr.com. I know it's a mouthful. It's probably not recommended, but I couldn't think of anything else at the time, so
Now
that's what it is.
we'll link straight to it. All right. Well, thank you so much for sharing your insights with us today, Cliff. We'll link to all those places, your website, etc., on the show notes, so you can check that out and everything else we covered today just by going to chiropracticeinsights.com. All right. Thanks
Thanks,
again, Cliff.
Sebastian.
Thank you.
Thanks for
Great,
having me.
great having you on.
Thank you.
Chiropractors, if you've tried advertising on social media only to be disappointed by the results, you're not alone. Often, the reason it doesn't work boils down to a lack of trust with your potential patients. That's why we created a simple method to build trust and attract high-quality patients. If you want to learn how to do this in only a few minutes each week, just go to hybridvideoblueprint.com.